Female reproductive functions जो हैं they can be divided into two major phases throughout the life of a female. One is preparation of the body for conception and pregnancy. So this happens most of the lifetime. ज़्यादातर जो फीमेल की reproductive age है उसमें the body actually tries to prepare itself for pregnancy and conception. So basically this happens every month. अभी हम पढ़ेंगे थोड़ी देर में कि every month the uterus undergoes changes as well as the ovary और हर वक्त हर महीने uterus की और female body की preparation होती है कि in case if the body becomes pregnant तो उसके लिए body prepare हो. So पहला phase जो पूरी females में reproductive life में majority of the portion होता है reproductive functions का वो है preparation for pregnancy. और फिर once the pregnancy happens then that's the second phase which is the period of pregnancy. ये जो पूरा chapter है this is chapter number 82 from Guyton and the title is Female Physiology Before Pregnancy and Female Hormones. So we will talk about how reproductive physiology works before the state of pregnancy and what are the different hormones that are responsible. मेरा नाम है आसिफ कुरैशी, आप देख रहे हैं डॉक्टर आसिफ lectures. So first of all let us talk about the physiological anatomy of female sexual organs. And we have done this in anatomy lectures, but very quickly here we know if we look directly at the diagram, so that is the side view, and you can see there is vagina, which is the tube where the copulatory organ of the male, which is the penis, enters, and vaginal canal leads to cervix, which leads to uterus, and obviously ये हम side से देख रहे हैं. अगर हम इस तरह से diagram देखें, so uterus के दोनों side पर there are these ovaries. And the ovaries are, present in the broad ligament and also contains ovarian ligament, so it is well supported. और ये uterus है. Uterus के साथ these are the fallopian tubes, and the fallopian tubes at the end have the fimbriae. होता ये है कि ओवरी के अंदर बहुत सारे देयर आर फॉलिकल्स जिनमें से ओवम निकलता है और ओवम यूं कैच हो जाता है फिम्ब्री में, फिम्ब्री से आता है फ्लोपियन ट्यूब में, और अगर यहाँ फर्टिलाइजेशन हो जाती है तो फिर जाइगोट मूव करता है, वरना ओवम मूव करता है यूट्रस में. एंड डिपेंडिंग अपॉन फर्टिलाइजेशन हुई है या नहीं हुई है, इफ फर्टिलाइजेशन हैपेंस तो जाइगोट आकर के यूट्राइन वॉल में फिक्स हो जाता है. लेकिन अगर फर्टिलाइजेशन नहीं हुई है तो ओवम फिर निकल जाता है इन द प्रोसेस ऑफ मेंस्ट्रुअल साइकिल. तो ये मेजर ऑर्गन्स हैं जो आपको पता होने चाहिए फीमेल रिप्रोडक्टिव सिस्टम के. ओके, सो देयर आर टू ओवरीज, टू fallopian tubes also known as uterine tubes. There is one uterus, vagina. Okay, reproduction begins in the development of ova in the ovaries. So ovaries में ova बनते हैं. In the middle of each month sexual cycle के there is single ovum which is expelled. So this is day 14 of the menstrual cycle when ovulation basically happens. And if fertilization happens then zygote will be formed. And if it doesn't fertilize, which means sperm अगर enter नहीं हुए उस टाइम पर मतलब इस टाइम पर 14th day of menstrual cycle के आसपास अगर sperm enter नहीं हुए तो fertilization का process नहीं होगा और ओवा menstrual cycle में bleed करके body से बाहर निकल जाएगा. Okay, so day 14 is very important if somebody is planning to get pregnant. इसीलिए मैं जब काउंसलिंग करता हूँ मैरिड कपल्स की, I mean this is a fact of life and this is reality that many of the married couple, male and female, they are actually unaware of the timings of copulation in order to get pregnant. This is very important that the female counts the menstrual cycle appropriately. उसे पता हो कि day 1 actually क्या है, उस day 1 से count करें and then you have to go up to day 14. So day 13 and day 15. This is the window जिसमें अगर fertilization होनी है तो ovum viable होगा. यानी if somebody is having sexual intercourse at say for example day 6 of the menstrual cycle, sperms enter. And ovum is going to come out at day 14. Sperm is not going to live until day 14. So day 6 वाला जो sperm है that will be dead by the time ovum comes. So ये ऐसे है कि sperm जब आया males में से उस वक्त ovum नहीं था और जब ovum आया तो उस वक्त sperm नहीं है. They have to be there at the same time and ovulation happens on day 14. Now there is also a technique to count the menstrual days. Many females don't actually know this as well, so this is very important that we teach them appropriately. Day 1 of the bleed is the day 1 of the new menstrual cycle. That is the simple story. अभी हम पढ़ेंगे भी आगे इसमें तो ये बात दोबारा आएगी. So stay tuned for that. Okay. What is the process of oogenesis and follicular development in the ovaries? होता ये है कि a developing egg, जिसको हम oocyte कहते हैं, it differentiates into a mature egg which is known as ovum. So oocyte is a developing egg and ovum is a developed mature egg. And this happens through a lot of steps, and all those steps are collectively known as oogenesis. जैसे spermatogenesis था for the development of the male sperms, इसी तरह females में जो ova बनते हैं या जो egg develop होते हैं, that happens through the process of oogenesis. Now, during the early embryonic development, primordial germ cells from the dorsal endoderm of yolk sac migrate along the mesentery of the hindgut to the outer surface of the ovary, which is covered by the germinal epithelium. So that is the yolk sac जहां से ये primordial germ cells migrate करके आते हैं ovarian location तक. During this migration, the germ cells keep on dividing rapidly and repeatedly. Once these primordial germ cells reach the germinal epithelium, they migrate into the substance of the ovarian cortex and become oogonia or the primordial ovia. So basically, जो ovary की location है, yolk sac से वहाँ से cell migrate करके आ रहे हैं, and they lie in the cortex of the ovary, and now they are known as primordial ova. So they are very, very premature type of ova. Each primordial ovum then collects around it a layer of spindle cells from the ovarian stroma and cause them to take on epithelioid characteristics. These epithelioid-like cells are now known as granulosa cells. So this is now the maturation of ova into the granulosa cell, and the ovum surrounded by a single layer of granulosa cell is now known as primordial. So the terms you need to remember is number one, the primordial germ cell. So this is in the yolk sac. Then number two, primordial ova, that is in the ovarian cortex, and then the primordial ova gets surrounded by the granulosa cell, and now this is known as primordial follicle number 3. So the primordial germ cells develops into primordial ova, and primordial ova develops into primordial follicle. ये terminologies important हैं. अगर आपको ये अभी से समझ में नहीं आएंगी तो आगे बड़ा मसला होगा. At this stage, the ovum is still immature, and it is now known as the primary oocyte. So जो ovum है उसको अब नाम दे रहे हैं primary oocyte. इसके इर्द गिर्द जो granulosa cell है, इस पूरे structure को नाम दे रहे हैं primordial follicle, लेकिन ovum को नाम दिया जा रहा है primary oocyte. Nomenclature important है, okay? The oogonia, oogonia is what? Oogonia is the primordial ova, okay? The oogonia in the embryonic ovary complete mitotic replication, and the first stage of meiosis starts here, because these are germ cells, they undergo meiosis, okay? The germ cell mitose and then cease, and no additional oocytes are formed. At birth, ovary contains, ye sune zara gaur se, 1 to 2 million primary oocytes are present in the ovary at the time of birth. The first stage of meiosis starts during the fetal development, but it is arrested. So actually जो female germ cells हैं उनकी development, उनका meiosis start हो जाता है but complete नहीं होता. वो prophase 1 में रुक जाते हैं until the female reaches to the age of puberty, which is 10 to 14 years of age. Or the first meiotic division of the oocyte is completed after puberty. Each oocyte divides into 2 cells as a result of the first meiotic division. And these 2 cells contain one large ovum called secondary oocyte, and the other one is a small first polar body. Each of these cells contain 23 duplicated chromosomes, because this is meiotic division, so 46 का chromosomal number अब half हो गया है. The first polar body may or may not undergo a second meiotic division and then disintegrates. The ovum undergoes a second meiotic division, because in meiosis there are 2 meiotic divisions, and after the sister chromatids separate, there is a pause in the meiosis. If the ovum is fertilized, the final step in meiosis occurs, and the sister chromatids in the ovum go to separate cells. So now females में अगर मैं आपसे कहूँ कि meiosis का process, तो the longest known meiotic process in our body is in the female germ cells. It starts embryonically and then arrested. Meiotic 1 complete होता है puberty के time पर, और meiotic division 2 complete होता है only when the female gets sperms and fertilization happens. When the ovary releases the ovum, ovulation का process, यानी हर 14th day of the menstrual cycle पर जब ovulation होती है, and if the ovum is fertilized, which means if the sperm is there, and the final meiosis यानी second meiotic division complete होता है, half of the sister chromatids remain in the fertilized ovum, and the other half are released in the second polar body, which is then disintegrated as well. At puberty, only about 300,000 oocytes remain in the ovaries, and only a small percentage of them become mature. That makes sense because we have a lot of oocytes, but only small percentage of them get mature. The many thousand of the oocytes that do not mature, they degenerate. During the reproductive years, यानी कि menstrual cycle से start होते हुए, say for example from the age of 14 years of age up till the age of menopause, जब तक menses रुक नहीं जाते, so that is known as the reproductive age, roughly around 13 to 46 years of age on average. इस पूरे टाइम में only about 400 to 500 primordial follicles develop to expel their ova. So that's a very small number. Compare it to the millions of primary oocytes that we have got. Only 400 and 500 become mature and they release their ova during the menstrual cycle. At the end of reproductive capability, which is what we call menopause. So the start of menstrual cycle is known as menarche and the end of menstrual cycle is known as menopause. Only a few primordial follicles remain in the ovary and even these follicles degenerate because now they do not menstruate and they are not ready for fertilization. Okay, so that's the kind of number game which you should know. It is pretty much interesting. अच्छा, female hormonal system भी males की तरह है. So there are like a 3 hierarchical system available. So 3 hierarchies are there. One is the hypothalamic control, जिसमें से निकलते हैं gonadotropin releasing hormone. ये males में भी निकलते हैं. ये जाकर के act करते हैं obviously anterior pituitary पे, जिनसे रिलीज होता है FSH, follicle stimulating hormone, and LH, luteinizing hormone. Both of them are released under the response of GnRH. So there is hypothalamus, and hypothalamus is releasing gonadotropin releasing hormone, and this hypothalamus gonadotropin releasing hormone goes and work on the anterior pituitary, and then the anterior pituitary releases follicle stimulating hormone and luteinizing hormone. Okay, and then there are ovarian hormones such as estrogen and progesterone, which are secreted by the ovaries in response to the female sex hormones from the anterior pituitary. So there is a three-layer system. The first layer is the hypothalamus, the second layer is the anterior pituitary, and then the third layer is the ovary actually. Okay. Hypothalamus से क्या निकल रहा है? Gonadotropin releasing hormone. Anterior pituitary से क्या निकल रहा है? FSH, LH. और ovary से क्या निकल रहा है? Estrogen और progesterone. इसको कंपेयर करो मेल्स के साथ, सेम स्टोरी थी, आपको याद है? gonadotropin releasing hormone, follicle stimulating, testosterone from the testes. The various hormones that are secreted at drastically different rates during the different parts of the female monthly sexual cycle. So शुरू के जो कुछ दिन हैं उसमें follicle stimulating hormone for example काफी ज़्यादा निकलता है, luteinizing hormone निकलता है, later days में कुछ और, so there is a cyclical change. So we will talk about the cyclical changes in a minute. Now the amount of gonadotropin releasing hormone जो hypothalamus से निकलता है, it increases and decreases much less drastically throughout the monthly sexual cycle. But the FSH and LH ये पूरे monthly cycle में जो females में 28 days का होता है menstrual cycle, उसमें ही fluctuate करते हैं. And we'll talk about the fluctuations in a minute. अभी हम इनकी बात करेंगे because menstrual cycle पे we'll touch upon this. And that comes with monthly ovarian cycle and function of the gonadotropic hormones. So the normal reproductive years of female are characterized by monthly rhythmic changes in the rate of secretion of female hormones and corresponding physical changes in the ovaries as well as in the other sexual organs. This rhythmic pattern is known as the female monthly sexual cycle. Yeah, this is also known as menstrual cycle. So the menstrual cycle which every normal female experiences is the monthly sexual cycle. The duration of the cycle on average in a normal female is about 28 days, but it may be short such as 20 days, it may be long such as 45 days. Also in the beginning at the time of menarche, when the menstrual cycles have just begun, it may take sometimes 1 to 2 years for this normal rhythm to be generated. Yani if you know a very young girl who has just started the process of these changes, these monthly cyclical changes, it may take some time for her to get to a regular 28-day cycle. Okay, the female sexual cycle has 2 significant results. यानी ये क्यों होता है? I mean, one might obviously argue कि why do female menstruate every month? It is for a very important, actually for 2 important reasons. Number one, as a result of this monthly cyclical hormonal changes, ovum is released. So that's first benefit. Every month female releases an ovum from the ovary, and the ovum actually looks for if there is a sperm available or not. If there is a sperm, then there is fertilization and zygote is produced and the pregnancy happens. So every month ovum is released. It seems like, this is actually true, that reproduction is an inherent property of living organisms. And in order to continue this inherent property, it is very important to release ovum all the time. So actually, look at the design of your body. Females ने हर महीने ovum release करना है, fertilization हो या ना हो, the body gets ready for fertilization. That's a very important point. And what is the second important objective of the menstrual cycle? The uterine endometrium is prepared in advance for the implantation of the fertilized egg. So both these properties, ovum का release होना और uterus की preparation, दोनों is for making the female body ready for pregnancy. हर महीने ovum भी निकल रहा है, यूट्रस भी प्रिपेयर हो रही है फॉर प्रेगनेंसी. अब अगर फर्टिलाइजेशन नहीं होती तो ऑब्वियसली फिर प्रेगनेंसी भी नहीं होगी और मेंस्ट्रुअल साइकिल होगा, ब्लीडिंग होगी, जो ओवम निकला है वो जाया हो जाएगा, यूट्रस में जो भी चेंजेस आए थे वो सब शेड हो जाएगी यूट्रस, और ब्लीडिंग के फॉर्म में मेंस्ट्रुअल साइकिल टर्मिनेट होगा. अगले महीने दोबारा यही स्टोरी शुरू होगी, फिर ओवम रिलीज होगा, फिर यूट्रस प्रिपेयर होगी. सो दैट गोज ऑन एंड ऑन एंड ऑन unless there is fertilization. Okay. Now, gonadotropic hormones and their effects on the ovaries. The ovarian changes that occur during sexual cycle depend completely on the gonadotropic hormone, FSH and LH, which are secreted obviously by the anterior pituitary, and you know this. Both FSH and LH are small glycoproteins that have molecular weights of about only 30,000 Dalton. Not important to remember actually. In the absence of these hormones, the ovarian system remains very, very inactive. So, they are very important for ovaries. At age 9 to 12 years, the pituitary begins to secrete progressively more FSH, because now the pituitary knows that the body is moving towards bigger age, adulthood. So it starts releasing more FSH and LH, which leads to the onset of normal menstrual cycle beginning somewhere around the age of 11 to 15. This period is known as puberty, and the start of menstrual cycle is known as menarche. End of menstrual cycle is then known as menopause, roughly around the age of 47, 48. Now, during each month of the female sexual cycle, there is cyclical increase and decrease in the FSH and LH. This is, ये भी हम पढ़ेंगे थोड़ी देर में. These cyclical variations in these hormones are basically, because of the changes in the anterior pituitary release, and as a result of these changes, पूरा जो uterus में pattern है वो change होता है. So, both FSH and LH, for example, stimulate their ovarian targets by combining with highly specific FSH and LH receptors. So, anterior pituitary से ये hormones निकल रहे हैं. These are very important. They go on to the ovary and there are receptors for them. In turn, the activated receptors increase the cell secretion rate and usually growth and proliferation of the cells as well. Amongst all these stimulatory effects resulting from the activation of the cyclic AMP second messenger system, there is formation of protein kinases and phosphorylation of the enzyme. So basically FSH or LH जो हैं, they work through cyclic AMP second messenger system. That's an important information for you. Okay. Now, throughout the childhood, the granulosa cell, जो कि ovum के around होते हैं, they are believed to provide nourishment to the ovum and to secrete oocyte maturation inhibition factor. So ये oocyte को mature नहीं होने देते. That keeps the ovum suspended in the primordial stage. मैंने आपको बताया ना कि meiotic division 1 तक ये रुके होते हैं until puberty, and meiotic division 2 सिर्फ उस वक्त complete होती है जब फर्टिलाइजेशन का प्रोसेस होता है. ओके, तो कौन रोके रखता है ओवम को फ्रॉम मैचुरेशन? It's the oocyte maturation inhibiting factor, which is released by the surrounding granulosa cells. Then after puberty, what happens कि FSH और LH जो हैं, they come from the anterior pituitary. इनके amount of secretion में significant increase होता है, and then these follicles begin to grow. The first stage of the follicular growth is moderate enlargement of the ovum, which increases in size in about 2 to 3 folds actually, and the stage is then followed by growth of the additional layer of granulosa cell, and these follicles are now known as the primary follicle. So basically ये diagram भी अगर आप देखें, so you now have an idea here. There are primordial follicle, very mature, then there are primary follicles which are then developed into different stages of follicular development. Ultimately what you get is the and this is the ovum, for example, and these surrounding cells are the granulosa cell, and ultimately the ovum is released. So that's what happens. Okay, the very, very important thing to understand. And this diagram also tells you that during oogenesis there are primordial germ cells which divide to replicate their own number, and they go to the ovarian cortex, and then the meiotic division 1 starts and then arrested. और ये complete होती है at the stage of puberty. So puberty पर we get first polar body which degenerates, and there is secondary oocyte formation which after fertilization only completes the second meiotic division, and then we get the zygote and the second polar body. So these are normal changes throughout the reproductive age, जो भी हमने यहाँ text में पढ़ा भी था, यहाँ diagrammatically इन्होंने बताया हुआ है. Okay. After the early proliferative phase of growth, which lasts for a few days, the mass of granulosa cells secrete follicular fluid that contains a very high concentration of estrogen, one of the important female sexual hormones. Accumulation of this fluid causes the antrum to appear in the mass of the granulosa cell as shown in figure 82.5. It's not something so specific here, जो कि मैं अलग से आपको दिखाऊं. The early growth of primary follicle up to the antral stage is then stimulated alone by FSH. Greatly accelerated growth then occurs, leading to still larger follicles which are called vesicular follicles, and this is caused by increasing FSH receptors. So FSH basically in follicles की growth को बहुत तेजी से इंक्रीज कर रहा है. सो इफ यू सी हियर, दिस इज व्हाट इज नोन एज द एंट्रल फॉलिकल. सो ग्रेन्युलोसा सेल जो है वो एक तरफ जमा हो रहे हैं. यू सी द चेंजेस, देयर इज एन एंट्रम फॉर्मेशन, ग्रेन्युलोसा सेल का नंबर बढ़ रहा है. सो एज सून एज द ग्रेन्युलोसा सेल का नंबर बढ़ता है एंड दे मूव टुवर्ड्स द पेरिफेरी, देयर इज अ कैविटी फॉर्मेशन नोन एज द, एंड ऑल दिस इज हैपनिंग, maturation of the follicle is happening under the influence of FSH. Actually, the pituitary, FSH and the estrogen combine to promote LH receptors as well on the original granulosa cells, therefore allowing the LH stimulation to occur in addition to FSH. So ये जो cells हैं, these are obviously all the cells. इन cells पर LH luteinizing hormone का receptor बढ़ाए जाते हैं. So FSH अपना काम करता जा रहा है, LH के receptors बढ़ते जा रहे हैं. As a result होता ये है कि जो antral follicles हैं, they begin to grow in their size and the growth is exponential. The ovum also enlarges to a diameter of 3 to 4 fold, giving a total ovum diameter of up to 10 fold at the end of the whole process. Or mass भी इसका increase हो रहा है. So again, if you look at the diagram here, starting from this small ovum, the size of the ovum is getting, you see now the ovum size is such a big ovum, it's increasing in mass and obviously it's increasing in weight as well. So there is maturation of follicle. और हर menstrual cycle पर there is only one follicle which fully matures. You know, every month only one follicle goes to the mature stage. After a week or more of growth, but before ovulation, yani it's before day 14 we are talking about, one of the follicles begin to outgrow all the others. Obviously there are so many follicles in the ovary, but one of them take up the pace and the remaining 5 to 11 follicles involute a process known as atresia. So सारे पीछे रह जाते हैं, एक आगे बढ़ जाता है. The cause of the atresia is still unclear, but it has been postulated to be the following. The large amount of estrogen from the most rapidly growing follicle act on the hypothalamus to depress further stimulation of FSH. This is very, very theoretical kind of stuff. So, ये जो follicles grow कर रहे हैं, ये follicles grow कर रहे हैं under the influence of FSH, which is coming from the anterior pituitary. And now, if one of them starts increasing rapidly in size and weight, it will start also producing estrogen. और ये estrogen जाके इस FSH को block करता है, तो बाकी जो follicles हैं, उनकी growth रुक जाती है. So that's the theoretical explanation up till now that we have got. Therefore, the largest follicle continue to grow because of its intrinsic positive feedback. अब ये जो फॉलिकल बड़ा हुआ है साइज में, इसमें जो ग्रैन्युलोसा सेल हैं ये खुद सेल्फ सस्टेन करते हैं, अपने हार्मोन्स डेवलप करते हैं और बाकी सारों को इन्होंने पीछे छोड़ दिया है. This process of atresia is important because it normally allows only one follicle to grow. Otherwise ये होता कि बहुत सारे ओवम रिलीज हो रहे होते, मल्टीपल प्रेगनेंसीज की सिचुएशन हो सकती थी. यूजुअली ये होता है कि there is one ovum released and therefore there is single pregnancy. The single follicle reaches to a diameter of 1 to 1.5 centimeter, and now this is known as the mature follicle. So जो follicle की maturation है primarily begins with the release of FSH, and then comes the day of ovulation. एक नॉर्मल फीमेल जिसका साइकिल 28 डे का है, उसमें ओव्यूलेशन रफली 14th डे ऑफ द मेंस्ट्रुअल साइकिल पर होती है. शॉर्टली बिफोर ओव्यूलेशन द प्रोट्रूडिंग आउटर वॉल ऑफ द फॉलिकल स्वेल्स रैपिडली एंड देयर इज अ स्पॉट व्हिच इज कॉल्ड स्टिग्मा. ऐसे वो फटता है और उस स्टिग्मा से फिर ओवम निकल आता है, एंड द विस्कस fluid carries with the ovum surrounded by a mass of several thousand small granulosa cell. This is known as corona radiata. So again, if you go back to the diagram and have a look here, सो ये था पूरे का पूरा फॉलिकल जो मेच्योर फॉलिकल है, और यहाँ अब ये हुआ कि फॉलिकल का बाकी का सारा सामान पीछे रह गया और ओवम उसमें से निकल गया। लेकिन ये जो ग्रेन्युलोसर सेल हैं ये थोड़े बहुत इसको सराउंड करते हैं। इस सराउंडिंग ग्रेन्युलोसर सेल के चक्कर को हम नाम देते हैं कोरोना रेडिएटा। बीच में ओवम है, पीछे खाली पैकेट रह गया, पैकेट में से चीज निकल गई, सिर्फ पैकेट पीछे रह गया, और ये पैकेट फिर आगे चल के कॉर्पस ल्यूटियम में कन्वर्ट हो जाता है, फिर जो कि बाद में डीजेनरेट हो जाता है एंड अल्टीमेटली इट फॉर्म्स कॉर्पस एल्बिकेंस। लेकिन जो कॉर्पस ल्यूटियम है ये दिखने में तो ऐसा लग रहा है और कहने में मैं कह रहा हूँ कि ये खाली डब्बा है जो आगे बढ़ रहा है, लेकिन बॉस एक्चुअली ये भी पूरा खाली डब्बा नहीं है। ये बहुत इंपॉर्टेंट चीज है, इसमें से इंपॉर्टेंट हार्मोन्स निकलते हैं, अभी हम उनके बारे में थोड़ी सी देर में डिस्कस करेंगे, ठीक है। तो ये ओव्यूलेशन की कहानी है, एंड ओव्यूलेशन हैपेंस बाय अ सर्ज ऑफ ल्यूटिनाइजिंग हार्मोन। जैसे ओवम की और फॉलिकल की मैच्योरेशन के लिए कौन सा हार्मोन इंपॉर्टेंट है, एफएसएच, ऐसे ओव्यूलेशन के फिनोमिना के लिए यानी पूरे फॉलिकल में से ओवम निकालने के लिए कौन सा हार्मोन इंपॉर्टेंट है, ल्यूटिनाइजिंग हार्मोन। इनिशिएशन ऑफ ओव्यूलेशन बेसिकली होता ये है कि देयर इज अ सर्ज ऑफ LH by the anterior pituitary, and this LH causes rapid secretion of follicular steroid hormone that contain progesterone. Within a few hours, two events occur. Number one, the theca externa, which is the capsule of the follicle, begins to release proteolytic enzyme from the lysosome. These enzyme causes dissolution of the follicular capsule. So basically ये जो पूरा follicle का setup है इसको डाइजेस्ट करना होगा तभी ये ओवम इसमें से निकलेगा। तो इसका जो डाइजेशन का फिनोमिना है, इसके डाइजेशन का जो प्रोसेस है थीका एक्सटर्ना को डिसॉल्व करने का, वो स्टार्ट हो जाता है बाय सम एंजाइम्स, प्रोटियोलाइटिक एंजाइम। एंड सेकंड थिंग इज देयर इज अ रैपिड ग्रोथ ऑफ न्यू ब्लड वेसल इन द फॉलिकल। एट द सेम टाइम प्रोस्टाग्लैंडिन्स आर सीक्रेटेड इनटू द फॉलिकुलर टिश्यूज एंड दे हेल्प the ovum to be released out of the follicle. इन दोनों इफेक्ट्स की वजह से होता यह है कि they cause plasma transudation into the follicle which contributes to follicle swelling. तो ये अगर follicle है, अब यहाँ blood vessel भी बढ़ जाएंगी और proteolytic enzyme भी, तो काफी सारा प्लाज्मा इसमें आएगा, ये भर जाएगा, इसमें बहुत लिक्विड जमा हो जाएगा, तो जो ओवम है उसको एक धक्का मिलेगा, पुश मिलेगा और वो ओवम बाहर आएगा। So that is what happens as an action of LH. So LH जब यहाँ एक्शन करेगा तो proteolytic enzymes रिलीज होंगे और blood vessels बनेंगी, अल्टीमेटली प्लाज्मा एंटर होगा इस पूरे मैच्योर फॉलिकल में एंड देयर विल बी अ पुश टू द ओवम एंड दैट इज हाउ ओव्यूलेशन occurs. Remember, it happens because of luteinizing hormone. अच्छा जी, अब कॉर्पस ल्यूटियम ये जो बना मैंने आपको अभी दिखाया ना कि जब ये इसमें से ओवम निकल गया, पीछे खाली थैला रह गया, खाली डब्बा रह गया, इसको हम कॉर्पस ल्यूटियम नाम देते हैं और मेंस्ट्रुअल साइकिल का ये फेज कहलाता है ल्यूटियल फेज। ड्यूरिंग द फर्स्ट फ्यू आवर्स आफ्टर एक्सपल्जन, यानी अब हम डे 14 की बात कर रहे हैं, ओव्यूलेशन हो चुकी है और उसके कुछ ही घंटों बाद व्हाट हैपेंड कि जो पीछे ग्रैन्युलोजर सेल यानी खाली डब्बा रह गया था, इट कन्वर्ट्स इनटू ल्यूटिन सेल्स व्हिच इनलार्ज, वो अपना साइज बढ़ा लेते हैं एंड येलोइश अपीयरेंस हो जाती है इनकी बिकॉज इसमें लिपिड इंक्लूजन्स जमा होना शुरू हो जाते हैं, प्रोसेस नोन एज ल्यूटिनाइजेशन। और अब इस पूरे खाली पैकेट को हम नाम देते हैं कॉर्पस ल्यूटियम। ये जो कॉर्पस ल्यूटियम है, दिस इज a well developed vascular supply also grows into this, so it becomes highly vascular, क्योंकि अभी थोड़ी देर में मैं आपको बताऊंगा कि इसमें से प्रोजेस्टेरोन निकलता है। So the granulosa cell in the corpus luteum, जो पीछे सेल्स बच गए हैं, ओवम तो निकल गया, पीछे granulosa cell रह गए, they develop extensive intracellular smooth endoplasmic reticulum and form large amount of female sex hormone known as progesterone. So corpus luteum is a very important source of progesterone as well as estrogen. और जो थीका सेल्स हैं form mainly the androgens, androstenedione and testosterone, rather than female sex hormones. So these are also produced, male sex hormones. However, most of these hormones are also converted by the enzyme aromatase in the granulosa cell. So ये जो remaining structure है ना, it is more than a खाली डब्बा. It is just not something कि जिसमें से ओवम निकल गया और पीछे पैकेट रह गया। ये शॉपिंग बैग नहीं है कि आपने शॉपिंग बैग में से खाने की कोई चीज निकाल दी और शॉपिंग बैग फेंक दिया। This shopping bag is very important. It is secreting a lot of important hormones, okay, including progesterone, including testosterone, estrogen, a lot of things. और फिर ये जो कॉर्पस ल्यूटियम है नॉर्मली ग्रोज अबाउट 1.5 सेंटीमीटर्स इन डायमीटर, रीचिंग दिस स्टेज ऑफ डेवलपमेंट पर 7 to 8 days आफ्टर ओव्यूलेशन। बड़ा इंपॉर्टेंट रोल है इसका। देन द कॉर्पस ल्यूटियम बिगिंस टू इनवॉल्यूट और अल्टीमेटली तकरीबन 12 दिन बाद ये बन जाता है कॉर्पस एल्बिकेंस। अब जब ये कॉर्पस एल्बिकेंस बन जाएगा, यहाँ एक इम्पॉर्टेंट शिफ्ट आएगा पूरे हार्मोनल सिस्टम में, जो अभी बताता हूँ थोड़ी देर में। इतना याद रहे कि प्रोजेस्टेरॉन निकलता है फ्रॉम कॉर्पस ल्यूटियम, एंड प्रोजेस्टेरॉन इज सुपर इंपॉर्टेंट फॉर द एंडोमेट्रियम ऑफ द यूट्रस टू गेट रेडी फॉर प्रेगनेंसी। और जब 12 दिन गुजर जाते हैं, यानी ये ग्राफियन फॉलिकल में से, मैच्योर फॉलिकल में से ओवम निकल गया, तो अभी भी फीमेल बॉडी को ये उम्मीद है कि फर्टिलाइजेशन होगी, तो ये पीछे प्रोजेस्टेरॉन रिलीज करना शुरू करता है ताकि यूट्रस प्रेगनेंसी के लिए तैयार रहे। लेकिन आफ्टर 10-12 डेज अब उम्मीद टूट गई, फर्टिलाइजेशन नहीं हुई, तो ये प्रोजेस्टेरॉन का लेवल कम होना शुरू होता है और अब मेंस्ट्रुएशन का प्रोसेस यानी ब्लीडिंग का प्रोसेस स्टार्ट हो जाता है कि भाई अब बस हो गई है, अब स्पर्म आएगा भी तो ओवम शायद डेड हो चुका हो। ओके, now luteinizing function of the luteinizing hormone. The change of the granulosa and theca internal cells into lutein cells depend mainly on the LH। यानी ये बार बार मैं आपको इस डायग्राम पे लेके जा रहा हूँ कि जब ओवर रिलीज हो गया, पीछे जो ग्रेन्युलोसा सेल बन गए, ये जो ल्यूटिनाइजिंग सेल्स बने हैं, ये जॉब भी ल्यूटिनाइजिंग हार्मोन का है। दैट इज ऑल्सो अंडर द एक्शन ऑफ ये ल्यूटिनाइजिंग हार्मोन। कितनी इंपॉर्टेंट चीज है आपकी बॉडी में। फीमेल्स में ओव्यूलेशन भी करा रहा है, पीछे ये येलो कलर के सेल्स भी बना रहा है, जिसको हम ल्यूटिनाइजेशन का प्रोसेस कहते हैं। ओके, a yet uncharacterized factor in the follicular fluid is the luteinizing inhibitory factor। यार ये अभी कंफ्यूज कर रहा है, छोड़ दो इसको। Secretion by the corpus luteum, an additional function of luteinizing hormone। The corpus luteum is highly secretory organ। सुने जरा, मैं खाली थैला कर रहा हूँ, लेकिन ये खाली थैला नहीं है भाई, ये secretory organ है। इसमें से प्रोजेस्टेरॉन बनता है, इसमें से ईस्ट्रोजन बनता है। So once LH has acted on the granulosa and theca cells to cause luteinization, newly formed lutein cells go through proliferation, secretion, degeneration, ये सब कुछ हो रहा है। और as discussed in the next chapter, pregnancy की जिसमें हम बात करेंगे, another hormone which almost exactly has the same properties as luteinizing hormone, chorionic gonadotropin, is secreted by the placenta, acts on the corpus luteum as well to prolong its life. Now that is a beautiful, super duper concept. Try to listen to this concept very carefully. So let me go to that diagram and there I will explain to you this particular concept here. अब बात सारी ये है कि ये जो ovulation हो गई इस पॉइंट पे, this is something which happens at day 14। ओव्यूलेशन हो गई, फीमेल बॉडी को अभी भी लग रहा है कि फर्टिलाइजेशन होगी, कोई उम्मीद है, स्पर्म आएगा, बच्चा होगा, ये सारी चीजें। तो बॉडी में ये जो कॉर्पस ल्यूटियम बना, इसमें से एक इंपॉर्टेंट हार्मोन निकल रहा है, प्रोजेस्टेरॉन। मैंने आपको बताया ये प्रोजेस्टेरॉन जाके यूट्रस को प्रिपेयर करता है, ये 9 से 11-12 दिन तक ये निकलता रहता है, लेकिन उसके बाद उम्मीद टूट जाती है। अगर फर्टिलाइजेशन नहीं हुई तो ये प्रोजेस्टेरॉन निकलना कम हो जाता है। लेकिन अगर फर्टिलाइजेशन हो गई तो जाइगोट बन जाएगा और उस जाइगोट को जाके यूट्रस में फिट होना होगा। यानी अब हमें प्रोजेस्टेरॉन के लेवल को कम नहीं करना, बल्कि प्रोजेस्टेरॉन के लेवल को हाई रखना है। हाई रखने का मतलब ये है कि अब हमें कॉर्पस ल्यूटियम को जिंदा रखना है। कॉर्पस ल्यूटियम को जिंदा रखने का मतलब ये है कि कोई ऐसा हार्मोन चाहिए जो इस कॉर्पस ल्यूटियम को जिंदा रखे, और वो है कोरियोनिक गोनेडोट्रोपिन, जो प्लेसेंटा से निकलता है। तो LH की तरह ये काम करता है। जैसे LH इसको लाइव रखता है, वाइबल रखता है प्रोजेस्टेरॉन सीक्रेट करने के लिए, LH काम करता है नॉन प्रेग्नेंट कॉर्पस ल्यूटियम पर, लेकिन कोरियोनिक गोनेडोट्रोपिन काम करता है प्रेग्नेंट कॉर्पस ल्यूटियम पर। तो अगर प्रेगनेंसी होगी तो अब चार्ज लेने आ जाएगा कोरियोनिक गोनेडोट्रोपिन। यार ये बड़े गोल्डन जुमले हैं मेरे, मुझे तो बड़े पसंद आए। इसको समझ में अगर आपके आ गए तो अच्छी बात है, वरना दोबारा सुनो मैंने क्या कहा। अच्छा, अगर फर्टिलाइजेशन नहीं होगी तो कॉर्पस ल्यूटियम इनवॉल्यूट करेगा, इट विल फॉर्म कार्पस एल्बिकेंस, and estrogen in particular and progesterone to a lesser extent secreted by the corpus luteum during the luteal phase of the ovarian cycle have a strong feedback on the anterior pituitary gland to maintain low secretory levels of FSH and LH. In addition, the lutein cells secrete inhibin, and inhibin is the same thing which is also secreted by the cervical cells of the testes, by the way. Now this hormone inhibits the FSH secretion. Low blood concentration of FSH and LH results, and loss of these hormone finally causes corpus luteum to degenerate, a process called involution, and ultimately they get corpus albicans। Okay, तो अगर इस पूरे की हम समरी देखें, so there is a 28-day cycle। 28-day cycle में डे 14 पर ओवम बाहर निकलेगा। इससे पहले FSH का मेन रोल है और ओव्यूलेशन पर LH का मेन रोल है, और उसके बाद प्रोजेस्टेरॉन का मेन रोल है। अगर प्रेगनेंसी होती है तो मामला कंटिन्यू रहेगा प्रोजेस्टेरॉन के रिलीज होने का। अगर प्रेगनेंसी नहीं होती तो ये सब लेवल्स डाउन होंगे और मेंस्ट्रुएशन का प्रोसेस स्टार्ट हो जाएगा। That's what happens. Okay, so there is 28-day cycle, gonadotropin hormone from the anterior pituitary, which means FSH, causes 8 to 12 follicle to grow, और इनमें से सिर्फ एक follicle grow करता है और 14 day पे ovum निकालता है. After ovulation, the secretory cells of the ovulating follicle develop into corpus luteum, and corpus luteum बनाएगा progesterone and estrogen. 2 वीक्स के बाद कॉर्पस ल्यूटियम डीजेनरेट हो जाएगा अगर फर्टिलाइजेशन नहीं हुई, लेकिन अगर फर्टिलाइजेशन हो गई तो कॉर्पस ल्यूटियम कहीं नहीं जा रहा, ये स्टे करेगा. ठीक है, विल सी कितने अरसे के लिए जब हम नेक्स्ट चैप्टर प्रेगनेंसी का पढ़ेंगे. नाउ आई हैव टू टेक यू थ्रू द फंक्शंस ऑफ ओवेरियन हार्मोन्स estradiol and progesterone. So very important two hormones and we'll talk about them. अच्छा, दो तरह के ओवेरियन सेक्सुअल हार्मोन्स हैं, estrogen and progestins. By far the most important of estrogens is the compound known as estradiol, और प्रोजेस्टिन में जो सबसे इंपॉर्टेंट या सबसे कॉमनली यूज कंपाउंड हम डिस्कस करते हैं, दैट इज द प्रोजेस्टेरोन. तो ये दो बिगर कैटेगरीज हैं, दो बिगर फैमिलीज हैं, एस्ट्रोजन एंड प्रोजेस्टिन, और उनकी स्पेसिफिक एग्जांपल्स हैं एस्ट्राडायोल एंड प्रोजेस्टेरोन. Estrogens mainly promote proliferation and growth of specific cells in the body that are responsible for development of most secondary sexual characteristics. So that is the job of the estrogens, secondary sexual characteristics in females. और जो progestins हैं, they function mainly to prepare the uterus. So the job of the progesterone is to mainly prepare the uterus for pregnancies and also the breast for lactation. So ये दोनों जो फीमेल सेक्स हार्मोन्स हैं, इनका डिवाइडेड डोमेन है. एस्ट्रोजेंस का प्राइमरी काम है टू डेवलप द सेकेंडरी सेक्सुअल कैरेक्टरिस्टिक्स, जैसे कि प्यूबिक हेयर्स हैं, चेंजेस इन द बॉडी शेप एंड स्केलेटन एंड ऑल दोस सॉर्ट ऑफ सेकेंडरी सेक्सुअल कैरेक्टर्स. और जो प्रोजेस्टेरोन है, इट फोकसेस ऑन द यूट्रस टू गेट इट रेडी फॉर pregnancy and also the breast to get it ready for lactation once the baby is produced. Okay, थोड़ी सी केमिस्ट्री इन्होंने बताई है. Estrogens in normal non-pregnant female, estrogen are secreted significant quantities में only by the ovaries. लेकिन during pregnancy it is also released by the placenta. So only 3 estrogens are present in significant quantities in the human females: beta estradiol, estrone, and estriol. And the formula of which are shown there, but I would say this is not important, so not recommended to actually remember these formula. Don't worry about them. The principal estrogen secreted by the ovaries is the beta estradiol. Small amounts of the estrone are also secreted, but most of this is formed in the peripheral tissues. So beta estradiol is the main thing produced by the ovaries. और जो estriol है, it's a weak estrogen. It is an anti-oxidative product derived from both estradiol as well as estrone. So ये थोड़े से केमिकल नाम है जो आपको याद रखने पड़ेंगे. The estrogenic proficiency of beta estradiol is 12 times as compared to estrone and 80 times as compared to beta estriol, not beta सिर्फ estradiol के साथ. So beta estradiol is the super estrogen compound basically, because ये बाकी के जो दो estrogenic compounds हैं उनसे highly efficient है. Estrone से भी highly efficient है और estriol से भी highly efficient है. Considering these relative potencies, one can see that the total estrogenic effect of beta estradiol is usually many times that of the other two even combined together. So मैंने कहा ना कि this is the hero molecule. और अगर progestins की बात करें तो by far the most important progestin is the progesterone. यही नाम आपने बार बार सुना भी होगा. However, small amounts of other progestins such as 17 alpha hydroxyprogesterone are also secreted, but progesterone is by far the most potent. In non-pregnant females, progesterone is usually secreted in significant amount only during the later half of the menstrual cycle, and that is released from the corpus luteum. लेकिन pregnancy में it is also released from the placenta. Okay? सिंथेसिस कहाँ होती है एस्ट्रोजेंस और प्रोजेस्टेरोन्स? आपको अभी मैंने लोकेशंस तो बता दी. नोट फ्रॉम द केमिकल फार्मूला, दैट्स एक्चुअली नॉट रिकमेंडेड टू स्टडी. यू डोंट हैव टू वरी अबाउट द केमिकल फार्मूले. ड्यूरिंग द सिंथेसिस मेनली प्रोजेस्टेरोन एंड एंड्रोजेंस आर सिंथेसाइज्ड फर्स्ट. Then during the follicular phase of the ovarian cycle, before these two initial hormones can leave the ovaries, almost all the androgens and much of the progesterone are converted into estrogen by aromatase. So aromatase is the one which actually converts androgens into progesterone into estrogen. Okay, but that chemistry is not at all recommended for you to remember. Estrogen and progesterones are transported in the blood bound to the plasma. That's an important point. They are bound to the protein and they travel in the blood. Both estrogen and progesterone are transported in the blood bound mainly to the plasma albumin, and with a specific estrogen and progesterone binding globulin. So these are the two proteins जिनके साथ ये bind करके blood में travel करते हैं. Okay, the binding between these hormones and the plasma protein is loose enough that they are rapidly released to the tissues over a period of 30 minutes. So obviously they travel in the blood because they have to be delivered somewhere. So for example, they have to go to the secondary sexual characters develop करने वाले cells, and they have to go to the uterus. So therefore they have to travel, and protein bound अगर so protein is just like a taxi basically. So that is a taxi. इसमें ये molecule बैठते हैं progesterone और estrogen के, और जब ये अपनी destination पर पहुंचते हैं तो जैसे passenger taxi से उतर जाते हैं, ऐसे ये molecules protein से निकल जाते हैं. Okay. Now, function of liver in estrogen degradation. Liver conjugate estrogen to form glucuronides and sulfates. So it is basically handling the degradation of estrogens. And about 1/5 of these conjugated product is secreted in the bile. Also, the liver converts potent estrogen estradiol and estrone into almost totally impotent estrogen, which is estriol. So liver kind of detoxifying center के तौर पे काम कर रहा है. Okay. Therefore, diminished liver function actually increases the activity of estrogens in the body, and this is called hyperestirinism. So अगर liver failure है, या liver cirrhosis है, या liver में cancer है, God forbid, या किसी भी वजह से liver में कोई issue है, तो estrogen की handling नहीं हो रही, levels of estrogen बढ़ जाएगा, और जब level of estrogens बढ़ जाएंगे, तो what will happen? Ultimately, estrogen predominant functions जो भी थे वो काफी ज्यादा होंगे, and that is called hyperestirinism. Okay. Now, fate of progesterone. Within a few minutes after secretion, almost all the progesterone is degraded to other steroid and have no progestational effect. As with the estrogen, the liver is especially important for this metabolic degradation. So liver is the key organ for degrading both progesterone and estrogen. The major end product of progesterone degradation is pregnandiol. About 10% of the original progesterone is excreted in the urine in this form. Although, one can estimate the rate of progesterone formation in the body from the rate of its excretion. क्योंकि जितना excrete हो रहा है उससे you can back calculate कि कितना actually produce हो रहा है. Function of the estrogen, their effect on the primary and the secondary female sexual character. I told you कि ये जो दो hormones हैं, one is the estrogen that is important for development of the secondary sexual characters, and the other one is the progesterone that is important for making the uterus ready for pregnancy and getting the mammary glands ready for lactation. So estrogen का जो primary function है, that is secondary sexual characters की development. Okay, effect of estrogen on the uterus and external female sexual organs. During childhood, estrogen are secreted only in minute quantities. Therefore, they have the baby bodies. But at the time of puberty, what happens? The quantities of estrogen increase because पूरा जो hormonal axis है, there is influence of the pituitary gonadotropic hormones, which increases about 20-fold. At this time, the female sexual characteristics changes from those of the child to that of an adult female. The ovaries and the fallopian tube and the uterus and the vagina all increase in size several fold, and then the external genitalia enlarge, the deposition of fat in the labia majora and labia minora and at the area of the mons pubis. So all these changes happen. Okay. In addition, estrogens change the vaginal epithelium to cuboidal to stratified, so getting all ready towards the adult type epithelium. During the first few years after puberty, the size of the uterus also increases, and there is considerable proliferation in the endometrial stroma or endometrial glands का size बढ़ता है, number बढ़ता है. So all these changes happen because of estrogen. So estrogen also works on the fallopian tubes, and the mucosal lining of the fallopian tubes are similar. वही इफेक्ट्स हैं सारे जो एंडोमेट्रियम पर हैं, यानी स्ट्रोमा, नंबर ऑफ सेल्स, नंबर ऑफ ग्लैंड्स, दे ऑल इंक्रीज आल्सो इन द fallopian tubes. They cause glandular tissue of this lining to proliferate. यही जो अभी मैं बात आपसे बता रहा था कि ग्लैंड्स का नंबर भी बढ़ता है, and also the activity of cilia is considerable. So basically ये हो रहा है कि from the baby body, these bodies are now getting ready to become adult bodies, and this is all happening under the influence of estrogen. And then there are obvious effects on the mammary tissues. The primordial breast of the females and males are exactly the same. In fact, under the influence of appropriate hormones, the masculine breast during the first 2 decades of the life can develop sufficiently to produce milk as well. I mean, in exactly the similar manner as that of the female if the hormonal setup was the same. Estrogen क्या क्या करता है mammary glands पर? Number one, development of the stromal tissue of the breast, and then growth of the extensive duct system, so the number of ducts increase, and deposition of fat. And these three cumulatively increase the size of the breast, obviously. So taken together, estrogen initiate the growth of the mammary glands and also the milk producing capacity. In terms के जो apparatus है, जो ducts हैं और जो cells हैं, उनका number बढ़ रहा है. Then estrogen also has an effect on the skeletal system. It inhibits the osteoclastic activity in the bone, so bone resorption नहीं होगी. Therefore, it stimulates bone growth. So estrogen से growth spurt आता है. Okay. As discussed in the chapter where we talked about calcium metabolism, at least part of this effect is due to stimulation of osteoprotein, which is also called osteoclastogenous inhibitory factor, a cytokine that inhibit bone resorption. So basically, जो estrogen का effect है on the osteoclast is mediated by these proteins. At the age of puberty, when the female enters her reproductive years, her growth in height becomes rapid for several years. So that's why she increases in her height at that menarche age. However, estrogen also uniting of the epiphysis. So at one point, the growth ceases as well because the epiphyseal closure once happens and union of the epiphyseal plates happen that stops the elongation of the bones. This effect of estrogen in female is much stronger than similar to that of the testosterone. Not important point. I think important point is covered. Skeleton में osteoclastic activity inhibit हो रही है and growth हो रही है, and also epiphyseal union is an important feature of estrogen activity. Osteoporosis of the bone caused by estrogen deficiency in old age. So basically, with the passage of age, when the female gets older, the estrogen levels go down, and that's actually a negative effect on the bone. Therefore, estrogen की जो deficiency है, that is associated with increased chances of osteoporosis, and that particularly happens after menopause. There is almost no estrogen there, और उस deficiency की वजह से अब osteoclastic activity बढ़ जाती है, because remember the estrogen was inhibiting the osteoclast. Now there is no one to inhibit osteoclast, and there is more osteoclastic activity, so the bones get resorbed. There is decreased bone matrix, and there is decreased deposition of the calcium and phosphate on the bone. So overall impact, osteoporosis. In some women, this defect is extremely severe, and the resulting condition is osteoporosis, which is a disease condition. And there can be sometimes hormone replacement therapy, estrogen replacement required to actually get the bone density to the normal levels. Estrogen also slightly increases protein deposition. It does so, it is evidenced by slight positive nitrogen balance when estrogens are administered. This effect mainly results from the growth promoting effect of the estrogen on sexual organs, the bones, so it is believed that it gets protein deposited in particular tissues. Estrogen also increases basal metabolism rate as well as fat deposition. Breast में भी हमने बात की थी. Estrogen increases the whole body metabolic rate slightly, but only about 1/3 as much the increase caused by the so testosterone is kind of more potent in terms of increasing the basal metabolism rate of the body. Estrogens have little effect on hair distribution. Estrogen do not greatly affect hair distribution. Testosterone so opposite function हो गया ना ये. However, hair does develop in the pubic region and in the axillary region after puberty as an effect of estrogen. Androgen formed in increased quantities by female adrenal gland after puberty are the mainly responsible things for, in addition to estrogen, I would say. Major role इनका नहीं, but ऐसा भी नहीं कि बिल्कुल role नहीं है. But females में अगर hair distribution patterns की बात की जाए, so perhaps estrogen से ज़्यादा more important are androgens, okay, which are produced from the adrenal glands. Effect of estrogen on the skin. It causes the skin to develop a texture that is soft and usually smooth. And it becomes very thicker and harsh and rough if the female is castrated. Estrogen also causes the skin to become more vascular, which is often associated with increased warmth of the. So these are the effects of estrogen on the skin. Pretty easy and self-explanatory. और estrogen का effect on the electrolyte balance, वो क्या होता है जनाब? Electrolyte balance पर this hormone estrogen causes basically जो adrenocortical hormones का जो effect है उससे काफी मिलता जुलता effect है. So what we mean is estrogens like aldosterone and some other adrenocortical hormones causes sodium and water retention. So that sort of thing. This effect of estrogen is normally slight and rarely of significance. However, during pregnancy, the tremendous formation of estrogen by the placenta may contribute to fluid retention, because estrogen is known for fluid retention, and obviously if the concentration of estrogen is very high, which is the case in pregnancy by the way, so उस वक्त जो overall body electrolyte and volume disturbances जो differences आते हैं एक pregnant female body में उसमें कुछ contribution estrogen की भी है. Okay, now what are the function of progesterone? It basically promotes secretory changes in the uterus. A major function of the progesterone is to promote secretory changes in the uterine endometrium during the later half of the menstrual cycle. Now, later half because all progesterone starts coming after the process of ovulation. So, once the ovum is out, the corpus luteum, which was behind left, ovum to nikal gaya, now the corpus luteum, it start releasing progesterone. So, it comes in the second half, okay? So, if you look at the diagram, so this is a nice diagram to interpret, and you should be able to get this very, very clear. So, this is the developing follicular phase, and this is perhaps day 14, which is the ovulation, ovum out, and now we have the corpus luteum. This is the time when there is a lot of progesterone. So, why? Because corpus luteum will release progesterone, and progesterone released by the corpus luteum is then responsible for the secretory phase. It increases the endometrial secretory gland. So it comes in the later half of the menstrual cycle. That's an important point to remember. Now, this function is discussed later in the connection with the endometrial cycle of the uterus. In addition to this effect on the endometrium, the progesterone decreases the frequency and intensity of the uterine contraction, thereby helping to prevent expulsion. Obviously, it makes sense because the job of the progesterone is to maintain the uterus for a pregnant scenario, and it will not increase contraction, because agar contractions increase hongi, then what will happen is whatever is in the uterus will be expelled out, and this is something that we don't want in the time period of pregnancy. Therefore, progesterone decrease the contractions of uterus. Progesterone promote the secretion by the fallopian tube as well. जैसे ये एंडोमेट्रियम में सिक्रीशन इंक्रीज कर रहा है, ऐसे fallopian tube में भी इंक्रीज कर रहा है. It also promote the development of breast, because I told you progesterone के दो काम हैं. Number one, get the uterus ready for pregnancy, and get the breast ready for lactation. So that's what its job is. Okay, progesterone does not cause the alveoli to secrete milk; it just increases the number. Okay, so it promotes the development of the lobule and the alveoli and the ducts, but the job of prolactin is basically to get the milk secreted from these ducts. Okay, progesterone also causes breast to swell. Part of this swelling is due to secretory development, because there is a lot of lobules and ducts now under the influence of progesterone. अब ये एक बहुत इंपॉर्टेंट पार्ट है कि ड्यूरिंग द मेंस्ट्रुअल साइकिल या ओवेरियन साइकिल कह लें या उसको सेक्सुअल रिप्रोडक्टिव साइकिल ऑफ फीमेल कह लें, व्हाट आर द चेंजेस दैट हैपन इन द यूट्रस पर क्या इफेक्ट्स आते हैं. ये बड़ा इंपॉर्टेंट है, बहुत पूछते हैं एग्जाम में. एसोसिएटेड विद द मंथली साइकिल प्रोडक्शन ऑफ द एस्ट्रोजन एंड प्रोजेस्टेरोन बाय द ओवरीज is an endometrial cycle associated, which is very cyclical, comes every month, and it is very, very systemic. So number one, there is a proliferation of uterine endothelium, then there is development of secretory changes in the uterus, and then there is desquamation, or which is what we call menstruation. So if you look again at this diagram, it's a very good diagram to understand. This blue thing, this is the proliferative phase, and this is where FSH is in big quantity and the follicles are developing. At day 14, there is LH, luteinizing hormone, coming into the picture. Ovulation happens, and after day 14 is the secretory phase where corpus luteum, ये जो ovum निकलने के बाद पीछे yellow bag बच गया, जिसमें काफी सारे granulosa cells हैं, उनमें से progesterone निकल रहा है. They actually prepare the uterus for pregnancy. In case if pregnancy happens, because ovum तो release हुआ ही है, so in case if pregnancy happens, the uterus is ready for holding the zygote basically. So if you count the number of days, ovulation is happening at day number 14. So later on, progesterone release हुआ है, corpus luteum है. Up till the next 26-28 days, what happens is कि the uterus tries to prepare itself for pregnancy, but if there is no fertilization, then ultimately, all this preparation of the uterus will shed off. It will, die, and it will come out from the female body in the form of bleeding. This is what we call the menstruation, and then after this, menstrual, phase begins, and this is all bleeding. All the glands, all the epithelial cells which were multiplied and replicated, now they shed off, और ये bleeding के form में निकल जाते हैं. So important point here very, very important point rather is day 1 of the bleeding, this is where bleeding starts. Day 1 of the bleeding is day 1 of the new menstrual cycle. So that's how you count your days, okay? So when the bleeding begins, it is day 1 of the next menstrual cycle, or you can say it is day last of the previous menstrual cycle, because the whole menstrual cycle built upon, and then when fertilization is not there, bleeding starts. And when bleeding starts, it is day 1 of the bleeding and day 1 of the new menstrual cycle. So you start counting from there, and once you reach day 14, this is the time when ovulation will happen. Okay, तो ये सारे जो changes हैं ये यहाँ पे भी हम देख लेते हैं. Proliferative जो phase है, that is also called estrogen phase. This is the phase before ovulation. There is a lot of estrogen there. Proliferative phase. Okay. At the beginning of each monthly cycle, most of the endometrium has been desquamated by menstruation. Sub shed off हो गई. After menstruation, only a thin layer of endometrial stroma remains. And then under the influence of estrogen secreted in increasing quantity by the ovary during the first part of the menstrual cycle, the epithelial cells of the endometrium rapidly proliferate. The endometrial surface is reepithelialized 4 to 7 days of menstruation, और साथ साथ FSH के अंदर follicles की growth भी हो रही होती है. Okay? Then comes the secretory phase, which is the progestational phase, and this happens because of corpus luteum. ये बात मैंने कई दफा आपको बता दी. Corpus luteum से progesterone निकलता है और वो proliferation करवाता है endometrial glands की, so that if fertilization happens, it can be fixed into the uterus. लेकिन अगर fertilization नहीं होती, then menstruation happen and everything goes away. Okay? So ये simple सी बात है जो हम कई दफा डिस्कस कर चुके हैं. आपको ये पता होना चाहिए कि ये टाइम पीरियड ऑफ डे 14 फर्टिलाइजेशन का, एक दिन इधर एक दिन उधर, दैट्स द टाइम व्हेन द स्पर्म्स मस्ट कम हियर इफ समबडी इज प्लानिंग फॉर प्रेगनेंसी, राइट? Now that's all basically it. And during the normal menstruation, approximately 40 milliliters of blood and an additional 35 milliliters of the serous fluid are lost from the body, and the menstrual fluid is normally non-clotting because it contains fibrinolysin release along with the necrotic endometrial material, which does not allow it to clot. Okay, if heavy bleeding occurs from the uterine surface, the quantity of the fibrinolysin may be insufficient, इसलिए some of the blood जो अगर बहुत ज़्यादा amount में release हो रहा है may also clot. Menstrual blood clots are not uncommon and unusual because menorrhagia, increased bleeding, is something very, very common. Within 4 to 7 days after menstruation starts, the loss of blood ceases because by this time the endometrium starts becoming reepithelization. So, ये वाला आपने अगर पूरा टेबल ये फिगर याद रखी हुई है, then you are good. Starting phase is the proliferative phase, estrogen and FSH, and the after ovulation is the progesterone secretory phase, and then at day 28 menstruation starts. Day 1 of bleeding is day 1 of the next menstrual cycle. Okay. Then this is very common terminology, leukorrhea. अक्सर फीमेल को ये इशू रहता भी है during menstruation. Large number of leukocytes are released along with the necrotic material in the blood. A substance liberated by the endometrial necrosis likely causes this outflow of leukocytes. As a result, the presence of these leukocytes and so many other factors, the uterus is highly resistant to infection during menstruation. Even though the endometrial surfaces are denuded, the resistance to infection are extremely positive values. So, leukorrhea is something protective. It is like fever. When you have got fever, it is an alarm. So, leukorrhea is protective in normal ranges, so it prevents infection. Okay, so that was all important discussion about what happens to uterus with each menstrual cycle. Now, how the monthly rhythm is actually regulated is the next topic of discussion. अब ये topic इतना ज़्यादा difficult इसलिए नहीं है क्योंकि हम इसकी बार-बार बात करते आ रहे हैं कि there are 3 hierarchical systems. First, there is hypothalamus, which releases gonadotropin-releasing hormone. Then there is anterior pituitary, which releases FSH and LH. And then we have ovary, which releases estrogen and progesterone. तो यही control mechanism है. So there is a hypothalamus axis, which releases gonadotropin-releasing hormone. इस gonadotropin-releasing hormone की further chemistry और ये सब important नहीं है यार, so don't worry about it. Intermittent pulsatile secretion of gonadotropin releasing hormone by the hypothalamus stimulate the pulsatile release of LH from the anterior pituitary, and this pulsatile release is important because that leads to surge of LH, which leads to ovulation. इससे ज़्यादा details I don't recommend to study or remember. Okay. Hypothalamic centers for release of gonadotropin releasing hormone. The neural activity that causes the pulsatile release of GnRH in humans occurs primarily in the medio-based, not important. Absolutely Don't worry about this, okay? Have my words, have my words. This is not important, not tested in the exam. Now, negative feedback effects of the estrogen and progesterone to decrease the FSH and LH secretion. So this is something like very simple to understand. If you have more estrogen and progesterone, they go to the anti-pituitary, negative feedback on the release of their inducers, okay? Inhibin from the corpus luteum also inhibits FSH and LH. So एक दफा अगर corpus luteum बन गया तो वो फिर इनको जाकर के रोकता है कि भाई भी रुक जाओ, हो सकता है pregnancy हो जाए. We may want to go in the direction of more progesterone. So you guys stop for a minute. So this compound from corpus luteum try to inhibit FSH and LH. As a positive feedback effect of estrogen before ovulation, the pre-ovulatory luteinizing hormone surge. The anterior pituitary gland secretes greatly increased amount of LH for 1 to 2 days, beginning 24 to 48 hours of what? Before ovulation. This effect is the most. Yeah, actually, I would just ask you to leave these. ना ये experimental physiological details not important. जो चीज़ important नहीं है मैं उस पे आपका hard disk का space consume नहीं करूँगा. Now, feedback oscillation of the hypothalamic pituitary ovarian system. Now that we have discuss the interrelation of the different components of the female hormonal system, we can explain the feedback oscillation system. Post-ovulatory secretion of the ovarian hormones and depression of the pituitary gonadotropins. Because now this is an important discussion, so pay attention. Between ovulation and beginning of the menstruation. So ovulation is day 14, and then there are further 14 days, so day 28 per menstruation start होगी. So इस बीच की बात हो रही है. The corpus luteum secretes large quantities of progesterone and estrogen, as well as inhibin. All of them go and block the release of FSH. है ना? They have a combined negative feedback on FSH and LH. So that's an important point. तो ये एक point register होना चाहिए आपको. Then the next one is follicular growth phase. 2 to 3 days before menstruation, the corpus luteum has regressed. और corpus luteum किस में convert हो जाता है? Corpus albicans के अंदर. To almost total involution and secretion of estrogen and progesterone and inhibin goes down. जब ये down हो जाते हैं तो what will happen कि FSH दोबारा बढ़ना शुरू हो जाएगा as much as twofold. Several days after menstruation begins, LH secretion also increases because इनको रोकने वाले अब है नहीं ना. इनको रोकने वाले estrogen थे, progesterone थे, inhibin थे, ये सब निकल रहे थे corpus luteum से. अब corpus luteum ही नहीं बचा, वो corpus albicans बन चुका है, तो FSH LH को रोकने वाला है कोई नहीं, तो ये amount में बढ़ना शुरू हो जाते हैं. These hormones initiate new ovarian फॉलिकुलर ग्रोथ. तो नया साइकिल स्टार्ट होने के लिए ये सारा सिस्टम जरूरी है, ओके? वरना अगर FSH और LH दोबारा नहीं आते तो नया साइकिल स्टार्ट नहीं होता. तीसरी चीज, प्री ओव्यूलेटरी सर्ज ऑफ LH एंड FSH कॉजेज ओव्यूलेशन. सो दैट्स वेरी इंपॉर्टेंट कि ओव्यूलेशन से स्लाइटली पहले, 1-2 दिन पहले LH का पीक होता है, ओके? अबाउट 11.5 to 12 days after the onset of the monthly cycle, the decline in the FSH and LH secretion comes to an abrupt halt. The high level of estrogen at this time is believed to cause a positive feedback stimulatory effect, and there is sudden rise in LH. And this sudden rise in LH, अभी हमने पढ़ा था इस चैप्टर के स्टार्ट में, causes ovulation. Now, what is an ovulatory cycle? Particularly at puberty, जब अभी start हुआ है menstrual cycle, the female has only started bleeding, and so at the age of 18 to 15 years, new menstrual cycles. If the pre-ovulatory surge of LH is not sufficient, then there will not be ovum release. So the cycle will be anovulatory. So everything will happen, but there is no ovum. Lack of ovulation causes failure of development of the corpus luteum. So there is almost no secretion of progesterone. Okay, fair enough. Because प्रोजेस्टेरॉन तब मिलेगा जब ये फॉलिकल में से ओवम निकल जाएगा और इस तरह पीछे खाली बैग बचेगा ग्रैन्युलोसा सेल का, जिसको हम कॉर्पस ल्यूटियम कहते हैं. अगर ओवम निकला ही नहीं तो ये बनेगा ही नहीं, ये बनेगा ही नहीं तो प्रोजेस्टेरॉन कहां से निकलेगा? द साइकिल इज शॉर्टेंड बाय सेवरल डेज बिकॉज द साइकिल्स आर एनओव्यूलेटरी. ओके, द फर्स्ट few cycles after the onset of puberty are usually anovulatory, so that's something very very normal. The term puberty and menarche, puberty means the age of adult sexual life, and menarche is the beginning of the menstrual cycle, usually 10 to 14 or 15 years, average is 12 years, right? So in females, obviously menstrual cycle hai. In the females as in the male, well, I'm not concerned with this. Then what is menopause? At the age of 40 to 50, the sexual cycle becomes irregular, ovulation fails, and the capacity to ovulate and have normal menstrual cycle goes away, and this is what we call the age of menopause. The cause of menopause is burning out, यानी ओवरी की अब बस हो गई है, पूरी लाइफ हर महीने एक ओवम निकाला है यार, पूरी लाइफ में ये काम चलता रहा है, अब बस हो गई है, इसको हम कहते हैं burn out, and there is now no cycles, I will stop working, retirement of ovaries is known as menopause. At about the age of 45, only a few primordial cells remain to be stimulated by FSH and LH, and FSH बेचारे आ रहे होते हैं लेकिन ओवरी अब काम के मूड में नहीं है. And when estrogen production falls below the critical value, the estrogen can no longer inhibit the production of FSH/LH instead. So that's not something जिसके लिए आपको परेशान होना है. ये जरूर है कि आपको ये पता हो कि जब menopause होगा, there will be low levels of estrogen, as a result of which there will be a lot of problems, such as at the time of menopause, women must readjust her life from one that she used to have previously. क्योंकि अब estrogen और progesterone नहीं है. So जब ये hormones नहीं होंगे, there will be hot flushes. Characterized by flushing of the skin. There are psychological issues. There's fatigue, irritability, anxiety, decrease, and osteoporosis, जो मैंने अभी थोड़ी देर पहले आपको बताया था, right? Large clinical trials have provided evidence that administration of estrogen after menopause, although ameliorating many of the symptoms of menopause, may increase the chances of cardiovascular diseases. So, अभी इस पर काफी रिसर्च चल रही है कि अगर मेनोपॉज अचीव हो जाता है तो उसके बाद ईस्ट्रोजन प्रोजेस्टेरोन की थेरेपी दें या नहीं दें, बिकॉज बास स्टडीज कहती हैं कि कुछ कैंसर्स के चांसेस बढ़ जाते हैं, बास कहती हैं कार्डियोवास्कुलर रिस्क बढ़ जाते हैं. तो दैट्स काइंड ऑफ नेचुरल चीज नेचुरल है यार, एक दफा रुक गई, अब उसको छेड़छाड़ करना मेरे हिसाब से बहुत अच्छा नहीं है. ओके, नाउ हमने मेल्स में भी पढ़ा था मेल सेक्सुअल एक्ट. मेल सेक्सुअल एक्ट ये था कि द पीनस becomes erect and it enters into the vagina and releases the sperm. So मैं उसको बताता था, उसको मैंने बताया था point and shoot. So point is for erection and that is the job of parasympathetic function, and shoot is the ejaculation and ejaculation is the job of sympathetic system. So erect the penis, get it into a female reproductive tract, shoot the sperms, and that is known as the male sexual act. Now, here we have to briefly talk about the female sexual act. So, stimulation of the female sexual act, as is true in the male sexual act, the successful performance of the female sexual act depend on both psychic stimulation and local stimulation. जैसे males में the glans penis has to be stimulated, testicular areas, anal areas, all these areas once physically stimulated leads to erection. इसी तरह females में भी there is local stimulation and thinking of the sexual thoughts, which is what we call the psychic stimulation. It leads to female sexual desire. Such desire is based on psychological and physiological drive, and although sexual desire does increase the proportion to the level of sex hormones secreted, desire also changes during the monthly sexual cycle, reaching a peak near the time of ovulation. So at the time of ovulation on day 14, there are high chances that many of the females experience high sexual desires. Okay, so that's pretty common at the time of ovulation. Local sexual stimulation in women occur in more or less the same manner as in men. So, for example, stimulation and rubbing of vulva, vagina, also nipples around the breast. These are the areas. Clitoris is highly sensitive. So, clit is highly sensitive organ, and stimulating the clitoris increases the sexual desire in females. As in male, the sexual sensory signals are transmitted to the sacral segments of the spinal cord through the pudendal nerve and the sacral plexus. Once these signals have entered the spinal cord, they are transmitted to the cerebrum. Also, local reflexes work as well through the sacral and lumbar spinal segments. Achha, female erection and lubrication, located around the introitus and extending into the clitoris, is in erectile tissues as well. So when I talk about this to my students, that female erection, they always get surprised. What are you talking about? Erection is only the phenomena in males because they have got a penis. But no, remember, clitoris also has erectile tissue. So there is also stimulation of clitoris, and the increased sexual desire lead to female erection. This is just like the erectile tissue in the penis in males. The erectile tissue like that of the penis is controlled by the parasympathetic. ये मैंने आपको पहले भी बात बताई है. Point and shoot. Point is erection. So point is parasympathetic. Okay. Females में भी ऐसा ही है. In the early phases of sexual stimulation, the parasympathetic signals dilate the arteries of the erectile tissue, and therefore blood comes in there, and there is erection of the clitoris erectile tissue. The parasympathetic signals also pass to the bilateral Bartholin glands located beneath the labia minora and causes them to secrete a lot of mucus. So if the female is sexually aroused, not only that the clitoris is erect, but they also secrete liquid, and that is also under parasympathetic signal. The mucus is responsible for much of the lubrication during this, and this is very much required. I mean, that's a physiological requirement. So imagine if this is vagina and penis has to enter here, so there may be a lot of friction. To reduce the friction, there has to be a lot of mucus, and that mucus is released by the glands, secreted by the parasympathetic system. Okay, the lubrication is necessary for intercourse, so that's a very important phenomenon. A massaging sensation constitutes the optimal stimulus for evoke. So again, physical stimulus, physical massage to clitoris, for example, can lead to lubrication because it activates the parasympathetic signals and activation of the glands. Now, what is female orgasm? When local sexual stimulation reaches maximum intensity, and especially when the local sensations are supported by appropriate psychic condition. So the female is not only experiencing physical, stimulation of her sexual organs, but she's also thinking in the same manner. So she is totally sexually aroused. So that leads to a peak of sexual stimulation, and that is what we call orgasm, या female climax. The female organism is analogous to emission and ejaculation in the male. So males में जो orgasm है basically वो release of sperm है. Ejaculation is the orgasm in males, and there is rhythmic contraction of the penile tissue. So that rhythmic contraction and release of sperm or semen is the orgasm in males, and it's pretty much similar in the females as well. Indeed, human female is known to be somewhat more fertile when inseminated by normal sexual intercourse rather than by artificial methods, because there is, at the time of female climax, there are contractions in the female reproductive tract. There is release of mucus and other secretions which are very important for sperm to travel. The contractions help the sperm, and the liquids help the sperm as well. First, during the orgasm, the perineal muscles of the female contract rhythmically, which result from the spinal cord reflexes, similar to that cause ejaculation in males. It is possible that these reflexes increase uterine and fallopian motility of the sperm as well. Also, the orgasm seems to cause dilation of the cervical canal for up to 30 minutes, thus allowing easy transport of the sperm. So the whole design is to help sperm enter and travel rapidly in the female genital tract and reach to the point of ovum entry, जो कि fallopian tubes में. Second, in many animals, copulation causes the posterior pituitary gland to secrete oxytocin as well. This effect is probably mediated through the brain amygdaloid nucleus, और oxytocin contraction करवाता है, आपको पता है ये बात. So those contractions also add up to the orgasm. In addition to the possible effects of orgasm on fertilization, the intense sexual sensation that develops during the orgasm also passes to the cerebrum and causes intense muscle tension throughout the body, which is kind of, to some, very, very healthy exercise. After culmination of the sexual act, the tension gives way during the succeeding minutes to sense of satisfaction. It's one of the very satisfying feelings one can ever have, and it is characterized by relaxed peacefulness and an effect known as resolution. So basically, orgasm is a very, very healthy exercise. Okay, this is one of the property of human beings. We are mammals, so we reproduce. So in order to reproduce, we have this kind of I call it the pleasure movement. And the pleasure movement is the orgasm movement. Okay, so this particular phenomena is not restricted to male; it is also equally present in females, and this helps the transport of sperm. So that is all about the female reproductive system. I will see you in another chapter very soon. तब तक के लिए अपना ख्याल रखिएगा.